5 months, 9 pharma plants have come under USFDA lens. So the question now is the US regulator in overdrive, and what really is ailing India's pharma sector? Joining us now for clarity is Kewal Handa, the former managing director of Pfizer. Mr. Handa, appreciate you joining us. Let me start by asking you to explain this to us. Is there a schedule, for instance, that the US FDA follows? Because it seems like there is a rash of observations coming in from the US FDA, not just for plants of lupin, which is the case today, but Dr. Reddy's, Cadilla, a bunch of other companies, Natco Pharma, all recently have gotten observations, warning letters from the US FDA. Can you explain this process to us, and why does it seem like the US FDA is in overdrive today?
In 2012, US FDA passed a bill called US Food Safety and Innovation Bill, whereby the plants which were outside US now would be audited regularly. Prior to that, only 7% of the plants were getting audited every year. As compared to the plants which were in US, 97% of them were audited once in 2 years. So the bill also says the backlog of audit will be completed within 5 years. So what we are seeing today is that they have increased the number of audits in this country. They increased the number of inspectors doing the audit, and therefore you are seeing more such cases coming up. Now, in global world, these are not that India is the only country where such cases of 483 and import alerts are taking place. But globally also we have seen that number of cases have gone up.
Okay, so you're saying the number of cases have gone up because the US is actually going ahead with much more of the audit process. But Mr. Handa, what seems to be the problem as far as India is concerned in specific? Because a lot of the observations that we're picking up across different pharma companies and across different facilities seem to be similar in nature.
So globally, the major 483 are given for two areas, is production and processes, that is manufacturing, production and processes, and also for correcting the action plans, correcting and remedying the action plans. But in India, what we are observing is more of a data integrity issue, where deliberately, consciously, either we fudge the data or we hide the data. We use poor excipients, poor raw materials, we use rejected materials, and I think this is something that is within the control of the management, and it requires a proper governance system, a good value system, and a good training at the grassroots level to avoid such repeated problems.
But to be fair, at least in the instance that we're talking about today, there is no concern as far as data integrity goes. But Mr. Handa, let me ask you now, if the US FDA seems to be finding so many faults or so many issues with Indian facilities, where is the Indian drug regulator? We haven't heard anything from the Indian drug regulator, but the supply of these drugs to the Indian market, to the domestic market, for instance.
So India do follow CGMP, and which is what all the plants are approved for. But we do not have a very strong rigor of inspection of the plants. Very recently there was a press item which says that now they are going to appoint almost about 20 inspectors to do about 200 plant units, which is just a drop in the ocean. I think we need to have a same type of frequency of audit as is laid down in the USFDA. And also you remember that the CGMP of India is much lower as compared to the stringent requirement of USFDA. So there is two different type of, the audits that you will see. The USFDA audit will be still tougher in spite of the fact that you may pass the CGMP of India audit. Now just coming on the lupin case, I believe what lupin is saying, that they believe it is a voluntary action indicated. The final report has not yet come. This is just an inspection observation. The final report can be a voluntary action indicated, or it could be an official action indicated. When it is an official action indicated, then you are crossing that border, and probably there would be a warning letter and then an import alert, and therefore the plant may have to shut down.
You're absolutely right. The FDA has not given a conclusion so far. This is the belief of Lupin in this matter, that it will be voluntary action initiated and will not go down the road of remediation required by the US FDA. But finally, before I let you go, Mr. Handa, what does this mean now as far as Brand India is concerned? We are the low-cost manufacturing hub. We are the generics hub of the world. This rash of observations that seem to be coming in, not just from the USFDA, but you also have the UK regulator, for instance, making similar observations. What does this mean as far as Brand India is concerned?
So Indian export and Indian generic export is still very grand. We are the largest supplier of generic products to US. US needs us, we need US. US needs us because they are increasing the generic proportion in their global pharmaceutical business. They want to go up to 75%, so they need us. And we need US. Therefore, recently the top Indian companies, owners and CEOs got together and said, what is that we need to do to build a Brand India image? I think now they are realizing it, that you can't take shortcuts, you can't play with the audits. Quality is not just for inspection, quality is all the time and everywhere. I think that's something that they have to realize it if they want to play in the US market.
All right, Kewal Handa, we will have to leave it there, but thank you very much for explaining to us what this FDA action means for the Indian generic business and what we can expect now going forward. But thanks for your time. With that, it is time for us to wrap up this edition of What's Hot.